Kate, I know that you have had a disability for 20 of your 25 years, and no doubt have had lots of experiences with healthcare providers, including nurses and nurse practitioners. I'd like you to tell us a little bit about your disability, and then we'll talk about some specific issues.
Sure. So I am a C7 T1 quad. I was in a car accident 20 years ago when I was 5 years old, and I was actually on my way to nursery school, so crushed a few vertebrae. So I'm a quadriplegic, paralyzed, chest down. Very independent. Post-trauma and some resulting surgeries, I gained a lot of my independence back and learned, through rehab and everything else, just sort of how to do the day-to-day living, but also how to drive, how to swim, how to bike, how to do all these different things and kind of reintegrate myself in a new way.
Mm-hmm. And you have had a number of interactions with healthcare providers, am I correct?
Absolutely.
Can you give us some examples of some positive experiences and encounters that you've had?
Sure. Recently, I went to a physician's office, and they knew ahead of time that I was in a wheelchair, so the room that they put me in had a adjustable bed that moved up and down. So they were great about finding the right height, asking what kind of help I needed, making sure I was comfortable, even just kind of standing there as I transferred. All those different things just made for a really easy visit. And it was the first time that I was there, so it was a great first step. Some other experiences, I would say just, in an original intake, someone really asking about my disability, getting the full information, regardless of why I'm there. Mm-hmm. Just to have my entire medical history kind of in front of them, it's really helpful for me and it's really helpful for them. Then we're all on the same page.
So they didn't ignore the disability, but concentrated as well on other issues that you went for in the first place.
Absolutely. It wasn't just about my disability, but it wasn't just about, what else I was there for. It was the whole kind of package. Absolutely.
And have you had some negative experiences?
Have had those too, unfortunately. Kind of the exact opposite a little bit. You get into an office and they kind of ignore the fact that you're in a wheelchair, or they feel uncomfortable about it. When really, it's a piece of the puzzle, so you can't completely ignore it. You need to ask about it. You want to have my medical history. I've gone into physicians' offices that aren't accessible, and that's really difficult. Or you get into a room and they want you on a table, but it doesn't lower, and they're not necessarily thinking about, all right, how can we do this? And they don't want to ask how they can do it, or what's the best option. So those are tough experiences because you want that whole package, and you want that visit to be what it should be. But if you can't get on the table, or they can't do the right examination, or they're ignoring the fact that you have a complete other health issue that might play a role into why you're there, or affect medications or things along those lines, that's tough. That's a tough negative experience.
Have you had experience as a patient in the hospital?
In terms of negative things there, definitely. I mean, I think people aren't always thinking from my perspective, so it's how does everything all fit together, or also kind of ignoring the fact that I really shouldn't be laying in that bed for that long because I can't move my legs. So it's about keeping an eye on those extra things that are really pertinent to my disability. So pressure sores, things along those lines, understanding dysreflexia and what might be causing it. So that heart monitor might be going off, but it could be completely different than what it is. So sometimes those experiences are having someone think in a little bit of a different perspective, or ask the right questions, or start talking about it. That's a big piece.
Have you found that some healthcare providers are afraid to ask about the disability?
I think sometimes they might not necessarily be afraid, but they might be uncomfortable about it. They're not really sure, should they or shouldn't they. And my role is always ask, and I will provide as much information as I can. And if somebody doesn't want to provide something, then I guess that's their own prerogative, but always asking, I think, is a huge piece. I think some people might not have dealt with someone with a disability in a regular general practice or something along those lines. Obviously, a lot of my specialists have. They see a lot of people with different types of disabilities. But I'd say if I'm going to a regular, you know, if I'm going to the eye doctor, or I'm going for just a general yearly checkup, or I have a sore throat. Those are the interactions where people aren't necessarily as used to someone with a disability showing up and needing, you know, any kind of regular care.
I was going to ask you, and you may have already answered this question, but is there one question that every healthcare provider should ask you?
One question, I would say probably the one biggest thing, you know, that's a good question for healthcare providers to ask is, you know, what, you know, how can I help you? What can I do? Things along those lines. Not necessarily giving assistance, but trying to understand what your own mobility and, you know, parameters are and what you can and can't do, how they and their staff might be able to make you feel more comfortable. And then in turn, I think that question makes them more comfortable too, because they know what to expect, or they know, hey, let's definitely put her in the room that has an adjustable bed, because that's the only way we're going to be able to really to treat her the best way, and the best way we're going to be able to assess what she needs. So I think that question really works for both sides of the spectrum, and works for both parties, because everyone knows then what to expect, how to treat, and just as that level of comfort. And I think when everyone has that level of comfort, then you dive right into the real reason you're there.
So a lot of what you're talking about relates to communication.
I think communication is huge in every aspect, from, you know, when you make the appointment to when you get in the room to when you know, follow up, reschedule, have to get medications, etc. I think communication flows through all of those pieces.
Okay. And if you had one message to give to nurses and nursing students about caring for people with disabilities, what would it be?
I think, I mean, it's, the biggest thing is not to ignore it, and to be comfortable asking questions and not worrying, you know, necessarily how I'm feeling about it. It's more so you want to get that full picture, and most people with a disability, they're going to be more than happy and ready to share that, because it's going to be a huge part of their own, you know, their own health and their own future and all the pieces that go into their own health care. I think that's a big thing, and if they don't know what to do, they should ask. So, you know, if they have to do vitals or something along those lines, and I'm, you know, on the other side of the room, or there are 1,000 obstacles in front of it, asking what they can do to help or to move things or to get me there is great. And I think not being afraid to do that is the biggest thing that people have to kind of think about, because I think sometimes it's overwhelming when it's something you might not have dealt with before. But when you do get into that kind of conversation, you know, things move freely, I guess you could say.
That sounds like an important message.
It's a huge message.
Thank you, Kate, very much.
Absolutely. Thank you.